Welcome to the Plastic Surgery Playbook.
Yeah, glad to be here.
We spend so much time on this show talking about optimizing our bodies, right? Like putting in the grueling work and just expecting this very straightforward set of results.
Oh, absolutely. The input-output machine mentality.
Exactly. We treat the human body like it's just basic math. You lift heavy things, your muscle fibers tear, and, well, they grow back larger.
Right.
Or you eat in the strict caloric deficit, your body needs energy, and boom, you lose fat. It's supposed to be simple.
But it rarely is it?
No, it really isn't. So today we are unpacking a very specific physical frustration that completely shatters that whole simple math rule.
It's a tough one, yeah.
It's a condition that so many men just quietly endure, and they assume, that it represents a failure of their own discipline or like a lack of willpower. But in reality, it's a completely biological quirk. We are talking about gynecomastia, or commonly known as male breast tissue.
Yeah, and the sheer number of men dealing with this is just staggering. I mean, the real tragedy here is the immense, completely unnecessary guilt that comes along for the ride.
Oh, the guilt is huge.
It really is. Men will spend years, like sometimes entire decades of their lives, trying to out-train a physiological condition that just... It doesn't care how many hours you spend on the decline bench press.
Right. To really understand what you as a listener might be going through, or what guys in general are going through, picture a guy who has just dedicated his entire life to fitness.
Oh, I know the type.
Right. He is tracking every single macronutrient. He's eating like boiled chicken breast and broccoli out of a sad little Tupperware.
Yeah.
He's doing endless punishing cardio sessions. He drops his body fat percentage down to the single digits. His arms look phenomenal. Shoulders are defined. But every time he looks in the mirror, his eyes just dart straight to his chest.
Because there's a fullness there.
Exactly. Specifically around the lower chest and the nipple.
Yeah.
And it just will not melt away. It doesn't matter how much he starves himself, right?
Yeah. No, doesn't matter at all. And the reason that guy is hitting a wall is based on, well, a pretty fundamental misunderstanding of human anatomy.
How so?
So, Dr. Joseph Hadid, who provides some really excellent surgical perspectives on this stuff, he points out that this endless frustration happens because true gynecomastia is a condition of the glands. It's not just a condition of fat.
Okay, wait. Glands versus fat, what's the practical difference there?
Right. So glandular tissue behaves entirely differently than adipose tissue, which is, the scientific term for fat.
Got it.
Adipose tissue essentially functions like a biological storage tank. When you enter that grueling calorie deficit you mentioned, your body drains those tanks for energy, and the fat cells physically shrink.
That makes sense.
But a gland is not a storage tank. It's structural. It's this dense, highly fibrous mass of tissue. You literally cannot cut your diet or do targeted resistance training to melt away a gland.
Wow.
Yeah. The gland just does not respond to metabolic changes in the blood the way fat cells do.
Okay, so knowing that the gym won't fix it is one thing. But if you're just a regular guy, standing in front of your bathroom mirror, poking at your chest, it all just looks and feels like unwanted fullness.
Right. It's hard to tell.
Yeah. I mean, determining whether you're dealing with stubborn chest fat or true glandular tissue without, like, a medical degree, it feels impossible.
It's actually not, though. Dr. Hadid outlines a physical difference that makes a lot of sense.
Oh, really? What is it?
Well, think about it like this. If you press firmly on simple chest fat, the sensation is very much like squeezing a water balloon.
A water balloon. Okay.
Yeah, it's soft, it yields to the pressure, and it disperses evenly under your fingers. But finding glandular tissue is a completely different tactile experience.
How does that feel?
It's much more like finding a golf ball hidden inside a pillow.
A golf ball in a pillow. That is a great visual, or, well, tactile, I guess.
Exactly. And that physical distinction is the clearest way to understand your own anatomy. Dr. Hadid actually recommends a really simple at-home test that you can perform right now.
Okay, walk us through it.
So you take your fingers and press firmly into the center of your chest, directly around and behind the areola. If the tissue feels completely soft and compressible, like all the way down to the pectoral muscle,
Then that's the water balloon.
right, you're likely just dealing with excess adipose tissue.
Yeah.
But if you press down and your fingers meet this defined, firm, rubbery lump situated right behind the areola, well, you found the golf ball in the pillow.
Wow, okay.
That localized rubbery mass is the glandular tissue. If you feel that, you're experiencing true gynecomastia.
I can imagine finding that rubbery lump immediately triggers just this massive wave of self-blame for guys.
Oh, absolutely.
You start rewinding your life, wondering if it was like that semester in college where you ate terribly or if you drank way too much beer in your 20s. You assume you did this to
That's
yourself.
the natural reaction, yeah.
But when we look at the clinical data, the cause is rarely just lifestyle, right?
It's actually far more complex than lifestyle choices. So we looked at Dr. Shim Ching. He's a highly experienced, board-certified plastic surgeon operating out of Honolulu, Hawaii.
Right. He's an incredible resource for this.
Definitely. And he notes that in the vast majority of cases, gynecomastia is categorized by the medical community as idiopathic.
Idiopathic, meaning what exactly?
It's basically the clinical way of saying it occurs spontaneously. It often triggers during the massive hormonal shifts of puberty, and the medical field doesn't have a specific pinpoint trigger for why it just stays.
So it just happens.
Yeah. Dr. Lauren Willoughby, who's featured on that popular YouTube channel Talking with Docs, she echoes this sentiment too. She notes that for a huge portion of the male population, the condition essentially boils down to just bad luck.
Bad luck. I mean, calling it bad luck feels a bit dismissive of what the body is actually doing, doesn't it?
A little bit, yeah.
Like, there has to be a mechanical, biological process happening behind the scenes to create physical breast tissue in a male body. The tissue doesn't just materialize out of thin air.
No, of course not. The underlying mechanism is completely driven by hormonal mechanics. Dr. Ching breaks down the cellular science in a really approachable way.
Okay, let's hear it.
First, we have to establish a biological baseline. All men naturally synthesize a small amount of female hormones in their testicles.
Right, that's just a standard feature of human biology.
Exactly. But the real catalyst involves an enzyme mechanism within the male body that actively converts testosterone, the primary male hormone, into estrogen, the primary female hormone.
Okay, the aromatization process.
Yes, aromatization.
So the male body is literally cannibalizing its own testosterone, running it through this enzymatic converter and turning it into estrogen.
That is exactly what's happening. And that process is happening in all men all the time, just maintaining a very specific, quiet equilibrium.
But I'm guessing that equilibrium can get messed up.
Oh, big time. In certain individuals, that balance just tips. Sometimes the body experiences an unexpected spike in estrogen production. In other cases, the male hormones simply exert less of a dominant controlling influence on the specific receptors located in the chest. And when that precise hormonal ratio is thrown off, the glandular tissue in the chest receives a chemical signal instructing it to grow.
Wow. So beyond just the natural chaos of puberty or genetic predisposition, are there external triggers that can force this hormonal ratio completely out of whack?
Yes, absolutely. Men are sometimes putting things into their bodies that act as the catalyst for this growth. Dr. Willoughby highlights several highly prevalent external catalysts.
Like what?
Well, the most widely recognized is the use of anabolic steroids.
Oh, right, which is exceptionally common in bodybuilding and fitness communities.
Exactly.
Talk about the ultimate biological irony, right? A guy turns to synthetic steroids because he wants to build this impossibly massive, hyper-masculine physique.
Yeah.
But because he is flooding his system with an unnatural excess of synthetic testosterone, his body's aromatase enzymes just go into overdrive.
Yep, they try to balance it out.
Right, so they convert all that excess straight into estrogen, which then signals the body to grow female breast tissue.
It perfectly illustrates how tightly regulated our internal systems are and, well, what happens when we try to aggressively override them.
Play stupid games, win stupid prizes, I guess.
Something like that.
Yeah.
But steroids are far from the only external trigger. Consistent, regular use of marijuana has actually been clinically shown to alter this hormonal balance and trigger glandular growth.
Look, really? Weed?
Yeah, weed. Furthermore, completely legal, necessary medications prescribed by your doctor can do it as well.
Oh, wow. Like what kind of meds?
Certain classes of blood pressure medications, for example, are known catalysts for tipping that estrogen-testosterone scale.
That is crazy. Okay, so if a guy does the at-home test, feels the firm lump, and recognizes that he might have triggered this, or maybe he's just had it since he was 15, the immediate impulse is probably to start searching for surgical fixes.
Right, you just want it gone.
Exactly. But jumping straight to a plastic surgeon skips a massive medical step, doesn't it?
A huge one. And Dr. Willoughby stresses this point emphatically. Before you even entertain the idea of aesthetic correction, a physician must conduct a comprehensive patient history and utilize ultrasound imaging on the chest.
To look for what?
Well, the medical community has to definitively rule out serious, life-threatening underlying conditions. While gynecomastia itself is generally benign, that severe hormonal imbalance can occasionally act as an early warning siren.
For cancer.
Yes, for testicular cancer or dangerous tumors located in the abdomen or even severe thyroid dysfunction.
Wow. So you must clear the critical medical hurdles to ensure you are healthy before you ever address the cosmetic reality.
Exactly. You can't just ignore the warning signs.
Okay, so assuming the ultrasound comes back clear and it really is just benign glandular tissue, we are left with this fascinating cultural contradiction.
Oh, this stigma.
Right. We know this is caused by puberty, bad luck, blood pressure meds, marijuana, a whole host of common triggers. It is happening everywhere. Yet, if you walk into a locker room or talk to guys at the bar, it is a total ghost topic.
Nobody talks about it.
No one mentions it.
The cultural silence is just deafening. And it's driven entirely by a profound, deeply ingrained stigma. Men feel emasculated by the condition, so they hide it.
Yeah.
But if you bypass the locker room chatter and look straight at the industry data, the numbers paint an entirely different picture of how common this truly is.
Right. Let's talk about those numbers. The data from the 2026 Industry Trend Report published by Medic Depot is incredibly revealing.
It really is.
Men currently represent 7% of the entire plastic surgery patient population, which is a noticeable upward trend from previous years.
7% is significant.
It is. And when you filter that data down to male-specific procedures, gynecomastia surgery is sitting at the absolute top of the list. We are talking about over 26,400 documented surgical cases in 2024 alone.
Over 26,000.
Yeah, and that represents a massive 10.9% increase from the prior year. This isn't some rare fringe procedure. Dr. Ching, operating out of Honolulu, notes that male breast reduction is his second most common consultation for men.
That surge of nearly 11% in a single year represents a very positive psychological shift, I think.
How so?
Well, the stigma is slowly cracking. Men are becoming educated about the biology. They're realizing that, like we said earlier, no amount of caloric restriction will dissolve a gland.
Right, you can't out-diet it.
Exactly.
Yeah.
And so they are seeking permanent medical solutions. For the patients undergoing this surgery, the outcome is profoundly satisfying.
I can imagine.
It isn't just about looking better in a t-shirt. I mean, it is about resolving a deep-seated, long-standing anxiety. It repairs a monumental blow to a man's self-confidence.
Yeah, it's got to be life-changing.
Totally. Many of these patients don't view the surgery as a cosmetic enhancement at all. To them, it is a restorative procedure. They're just trying to get their body back to its baseline state.
The psychological relief is huge. Guys talk about the mental exhaustion of wearing 2 shirts in the middle of summer just to hide the contour of their chest.
Oh, yeah. Or constantly hunching their shoulders forward to minimize the appearance of the gland.
Right. But here's the bizarre reality of the plastic surgery world right now. If over 26,000 men are getting this done and demand is just skyrocketing, the industry itself is doing a terrible job of making them feel welcome.
They really are.
The Medica Depot report exposes this massive marketing bias. Get this, 94.1% of all plastic surgery marketing images feature women.
Wow.
Only a measly 5% feature men.
It is an incredibly alienating experience for the male patient. I mean, think about it. You're a guy dealing with a vulnerable, deeply personal, physical insecurity.
Right.
You finally build up the courage to seek a medical solution, and you walk into a clinic lobby painted in soft pinks, surrounded by brochures exclusively advertising mommy makeovers and breast augmentations.
It's like you don't belong there.
Exactly. Even the practice websites rarely feature dedicated, easily accessible pages for male services. The aesthetic industry is drastically underrepresenting the male patient, and honestly, it subtly reinforces the very stigma that guys shouldn't be there in the first place.
Yeah, the industry is happy to take the revenue from that 10.9% increase, but they aren't updating their waiting rooms or their marketing to reflect the reality of their patient base.
Exactly.
But okay, let's say you push past the floral brochures, you get into the consultation room, and you are ready to fix the problem. You know, you can't push up your way out of it.
Right.
What does the surgical playbook actually entail?
Well, this is where surgical mastery becomes critical. And Dr. Shim Ching's technical breakdown is invaluable here. The specific anatomy of the patient's chest dictates the entire surgical approach.
Okay, so it's not a one-size-fits-all thing.
Not at all. When Dr. Ching evaluates a patient, he has to map out the terrain. Is the fullness primarily driven by excess adipose fat? Is it a dense block of glandular tissue? Or As is the case for the vast majority of patients, is it a combination of both?
Right, because you can't treat a fibrous gland with the same tools you use to remove fat.
Exactly. The approaches are entirely different. Adipose tissue, the fat, is highly responsive to liposuction. The surgeon will typically make a tiny discrete incision, often hidden out of the way in the armpit, and use a cannula to suction the fat away, effectively clearing out and flattening the sides of the chest.
That sounds standard, but what about the gland?
Right. The gland itself, that rubbery golf ball, is far too dense and fibrous to be suctioned through a tube. It must be physically, surgically excised.
Cut out, basically.
Yes. And Dr. Ching issues a very stern warning regarding this dual approach.
What's the warning?
If a surgeon attempts to treat gynecomastia using only liposuction, the dense gland is left behind, and the patient's chest still looks puffy and pointed directly behind the nipple.
Oh, that would be terrible.
It is. But conversely, if the surgeon only cuts out the gland and ignores the surrounding fat, the chest takes on a strange, disproportionate appearance. Achieving a natural aesthetic result almost always requires a specialized combination of both liposuction and physical excision.
Got it. And when we talk about physical excision, we have to talk about scarring.
Oh yes, scarring is a major concern.
Because the whole driving motivation for a guy seeking out the surgery is to be able to take his shirt off at the beach or the pool without feeling a wave of panic and self-consciousness.
Right.
If you simply trade puffy glandular tissue for massive, highly visible Frankenstein scars stretched across your pectoral muscles,
Yeah.
well, you haven't actually solved the psychological burden.
No, you've just changed the source of the insecurity.
Exactly. So how do they handle the scars?
Well, Dr. Ching's specific technique for scar placement is what separates standard results from master-level results. The traditional, older surgical approach often involved making an incision right along the border, the outer edge, where the areola meets the regular chest skin.
Okay, that sounds like it would be pretty visible.
It can be, but Dr. Ching favors placing the incision entirely within the pigmented tissue of the areola itself.
Oh, inside the areola.
Yes. The skin of the areola has a very specific, textured, somewhat bumpy quality to it, along with darker pigmentation. By hiding the incision completely within that textured area, the resulting scar blends into the natural anatomy as it heals.
That is brilliant.
It really is. For most patients, it becomes nearly invisible to the naked eye, completely masking the fact that an intervention ever took place.
Okay, so the hidden scar technique is great, but digging through Dr. Ching's clinical notes, there is a second major warning for guys evaluating potential surgeons.
And this is a big one.
Yeah, it revolves around the concept of taking out too much tissue. I mean, we naturally assume that if a gland is causing the problem, the surgeon should just aggressively remove 100% of it so it never comes back.
That's the instinct, sure.
But doing that creates a massive structural problem, right?
It creates what the industry refers to as the crater effect.
The crater effect, that does not sound good.
It isn't. To understand why this happens, you have to look at the specific layering of anatomy directly behind the nipple. Across the vast majority of your body, your anatomy follows a predictable pattern. It's skin, followed by a layer of subcutaneous fat, followed by muscle.
Right.
But the area right beneath the areola is unique. There is virtually no fat layer there at all.
Really?
Yeah. The only thing separating the skin of the areola from the pectoral muscle is a small amount of natural breast tissue, which, as we discussed, every single man possesses.
Wow. So if an inexperienced or overly aggressive surgeon goes in and scoops out every last microscopic trace of that glandular tissue, there is literally nothing left to support the skin.
Exactly. The skin of the areola literally collapses inward, adhering directly onto the chest muscle.
Oh, yikes.
Yeah. The patient wakes up and heals with a highly visible, unnatural indentation, a literal crater in the center of their chest. Dr. Ching emphasizes that the hallmark of an expert surgeon is knowing exactly how much to leave behind.
It's an art form.
It is. A master surgeon will deliberately leave a very thin, precise layer of tissue intact directly behind the nipple to ensure the chest maintains a natural, flat, supported contour.
That distinction between an amateur scooping everything out and an expert sculpting the contour is just critical. But even with a master surgeon hiding the scar and preventing the crater effect, this is still a major medical procedure.
Oh, absolutely. It's real surgery.
You are going under anesthesia, and you are having tissue physically removed. Dr. Willoughby's breakdown of the recovery process doesn't pull any punches regarding the potential risks.
And transparency about those surgical risks is mandatory. Dr. Willoughby outlines several potential complications that every patient must weigh.
Like what?
Well, there's always the risk of asymmetry, where the right side of the chest heals slightly differently or at a different rate than the left side.
Okay, that makes sense.
Depending on your individual genetics, you could also develop thickened, highly visible scarring, regardless of where the incision is placed. And because the surgeon is actively cutting fibrous tissue in an incredibly sensitive area packed with nerve endings, there is a very real risk of nerve damage.
Oh, wow.
Yeah, leading to nipple numbness that can sometimes be permanent.
Permanent numbness. That's a serious trade-off. And then there is the immediate aftermath of carving out that tissue, right? When you physically remove a chunk of a dense gland, you are leaving an empty pocket, a literal void inside the chest wall.
And the human body despises empty space.
What does it do?
Its immediate physiological response to an empty cavity is to flood it with fluid. Yeah. These fluid collections are called seromas, and preventing them is the primary focus of the postoperative recovery phase.
So how do you stop that from happening?
To stop a seroma from forming, patients are required to wear a specialized, incredibly tight compression garment wrapped around their chest for several weeks following the procedure.
A tight compression garment in the summer. Sounds fun.
It's not. But this garment is not optional. It forcefully presses the chest skin down onto the underlying pectoral muscle.
Okay, so it forces the tissue layers to adhere to one another.
Exactly. Physically eliminating any empty space where fluid could potentially pool.
Wow. So you endure the surgery, you survive the weeks of wearing a suffocating compression vest, and your chest finally heals flat and contoured.
And then comes the big question.
Right. The ultimate question every guy asks is this a permanent fix? Can this glandular tissue aggressively grow back and undo all of this pain and expense?
Well, for the overwhelming majority of men, the procedure is highly successful and completely permanent.
That's a relief.
It is. However, Dr. Willoughby points out that the body can betray you if you reintroduce the original catalyst.
Ah, right, the triggers.
Yes. If a patient recovers and immediately cycles back onto anabolic steroids, they are voluntarily reintroducing the exact chemical chaos and aromatization that forced the gland to grow in the first place.
So don't do that.
Definitely don't do that.
Yeah.
Alternatively, if a patient gains a massive amount of subcutaneous weight across their entire body, the chest region will inevitably expand as new adipose tissue is stored there.
Because fat is still fat.
Exactly. But assuming you maintain a relatively stable weight and steer clear of severe hormonal disruptors, the results of the surgery are enduring.
That is fantastic news. So, bringing this all together for you, the listener, if you are standing in front of the mirror, deeply frustrated by a chest that simply will not respond to your grueling workouts and strict diets, give yourself some grace.
Yeah, be kind to yourself.
The biological reality of male breast tissue, of true gynecomastia, is incredibly common. It is a condition rooted in complex enzymatic conversions, hormonal balances, and structural glands.
Right, it's not your fault.
It is definitively not a reflection of your work ethic, your discipline, or your masculinity. The stigma is slowly evaporating, and the medical solutions are highly refined, provided you seek out an expert who understands the delicate interplay of liposuction, precise glandular excision, and hidden scar placement.
It's amazing how far the techniques have come. And, the complex science governing how our bodies operate behind the scenes is just endlessly fascinating.
It really is.
Think about it. If the male body possesses the quiet, efficient capability to take its own primary hormone, testosterone, and aggressively convert it into estrogen, completely reshaping the dense physical structure of the chest in the process, it forces a broader realization.
Oh, like what?
It makes you wonder what other subtle, invisible hormonal conversions are constantly running in the background of our biology, secretly dictating our physical appearance, our daily energy reserves, and even our emotional states without us ever consciously realizing it.
Wow, that is a lot to think about. Thanks for listening to the Plastic Surgery Playbook. Until next time.